Welcome back. With me, I have the nutritionist we have in our office, Whitney. So a lot of people are dealing with food sensitivities, and what are some of the issues that you've seen people deal with when they come and also have food sensitivities at the same time?
Oftentimes they're having a lot of intestinal pain. They just cannot digest their food very well.
Okay.
And a lot of times they're confused about that because they're eating really healthy and they don't understand why they're still having gas or heartburn. They're not breaking it down and having good, bowel movements, just a lot of things that go along with you knowing that you're breaking down and assimilating your food correctly.
And the intestinal tract is such a core aspect of your overall health.
Mm-hmm. It's extremely important. Yeah, it's very, very important. If you're not able to actually break down and assimilate your nutrients, you're going to become malnourished.
Yeah.
There's no way around it.
So you may eat the perfect food, or you may take the perfect vitamins and nutrients, and you're still not able to utilize any of it.
Exactly. Yeah, and at the base of that, often when I do food sensitivity testing, is that their bodies are not utilizing their own digestive enzymes and their essential fatty acids.
Yeah.
And so when they eat the foods that are healthy, they are still not breaking them down because their digestive enzymes and essential fatty acids they're not working correctly.
So you have a way then of testing and seeing what digestive enzymes are out of balance then?
I do, yeah. In our office, I can actually isolate and go in and figure out which specific digestive enzymes to work on. And I usually start there when people are having food sensitivities, because oftentimes I've seen cases where people can't digest all kinds of foods.
Yes.
If we work on their digestive enzymes, all of a sudden they can digest a lot of foods pretty much instantly better.
Really?
Yeah.
So you've actually seen, just by working then on the digestive enzymes and then supporting them in that area. So does that, you've seen that impact? I mean, you've seen that direct
several
correlation?
times. I've seen that several times.
Yeah.
With people that are eating very, very clean and healthy, and all kinds of foods are hurting their stomach. I have a client who had a pain in her back for a couple years, and once we isolated what she was having a food sensitivity to, it was a couple different things. We removed those and worked on her digestive enzymes. The pain went away, and she was able to break down and assimilate her nutrients much better.
That's amazing. And so when you say work on their digestive enzymes, does that mean that you're giving them that digestive enzyme, or what does that mean?
I do what's called desensitization.
Okay.
And I work with the laser and different tapping techniques and breathing techniques. It takes about 15 minutes, and it's actually painless. It feels really, really good. A lot of clients, they leave very relaxed. And it takes 6 weeks. You come in once a week, and we work on which one I can identify that needs to be worked on the most.
Yeah.
And it just helps the body to utilize your own digestive enzymes so that even if you're taking them or getting them from food, then it can digest that from the food better.
Because a lot of people are frustrated. I mean, they find out they're gluten sensitive or dairy sensitive, or they're sensitive to corn, or they take these tests and say, the strawberries is sensitive to this, pineapple, and all these different things. So then by working on the digestive enzymes, you can then shift that?
Absolutely. Yeah, there's a lot of things that can weaken the digestive enzymes.
Yeah.
Having a poor diet, actually, too much sun exposure, a lot of acidic foods, pharmaceutical drugs. There's all kinds of things that can weaken those. And so if you don't work on strengthening those, it's hard to break down digestive enzymes in food or in supplements.
Okay. So, and what's interesting, I mean, from the technique that you use, I know you're tapping then of different acupressure points and then also using a laser. And what people don't realize is that when you have a food and you're sensitive to it, it first becomes a electrical event before it becomes a chemical, which means that it then actually impacts your nervous system before it impacts what kind of antibodies you're producing and so forth. So by tapping then on these meridian points, which are very electrical in nature, and then also using a laser, you will then balance the body's electrical reaction to that food. And that's what you do then in the office.
Yep, that's exactly what I do.
Wonderful, wonderful.
Yeah.
Well, thank you very much. And so food sensitivities, it's a huge, huge issue. And to be able then to pinpoint and see which food that is creating the imbalance. And then also we utilize then a technique that Jennifer uses in our office to help to balance the body in relationship to that food so that you don't have that stress reaction when you eat then that food. So after this, we'll be right back.